Hi friends, I am Dr. Pratap Sinato. I have done the MD in Forensic Medicine. In today's video, we'll continue with corrosive poisons. In that, we'll discuss about carbolic acid and other remaining corrosives. Coming to physical properties of carbolic acid, it appears as a colorless prismatic needle-like crystals which have a burning sweetish taste which turns pink and liquefy when exposed to air. The characteristic carbolic or has a phenolic smell is present of carbolic acid. It is a slightly soluble in water, but it's freely soluble in glycerin, ether, alcohol, and benzene. It is largely used as an antiseptic and disinfectant in various preparations. The various preparations includes like lysol, which is a 50% solution of cresol and saponified vegetable oil; phenol, which is about 8 times more toxic than lysol, which is the commonest used for cleaning the houses purposes, commonly used in many households; Dettol, which is used as antiseptic, is a chlorinated phenol with terphenol. Others include like cresol, creosote, thymol, menthol, and tannic acid, or all other preparations of carbolic acid. Absorption of carbolic acid, it is easily absorbed from mucous membranes like urinary tract, respiratory tract, rectum, vagina, serous cavities, wound, or through the skin also. Coming to excretion, phenol is converted into hydroquinone and paracatechol in the body before excreted in the urine. So, kidneys are the main organs where it is usually excreted. A trace amount is excreted in lungs, salivary glands, skin, and stomach. It is also partially detoxified by liver. Coming to fetal dose, it about 10 to 15 gram of carbolic acid crystals is about fetal, or 20 to 50 ml of household poison, which is used for purpose of cleaning purposes. 25 to 50 ml is fetal. Fetal period is about 3 to 4 hours. Poisoning by carbolic acid is called as carbolism. Coming to signs and symptoms, coming to local symptoms when it is on the skin mucous membrane. So on the skin, it causes burning and numbness due to damage to nerve endings. It precipitates protein and coagulates the cell. So whenever its concentrated form is present or applied on the skin, it causes numbness, and because of corrosive action, it causes coagulation of proteins of the cell and tends to stiffen the tissues, sometimes leading to scar formation, which is a white opaque scar which is painless and evenly fall off in few days. There is necrosis and ganglion formation also occur depending on the concentration, which becomes green white in color. Lysol, if it is present, it discolors the tissue to brownish purple in color. On the digestive tract, when it is taken ingested, it causes a burning sensation followed by tingling and loss of sensation from mouth to stomach. The person is not able to sense anything. He may not able to drink. Deglutition, speech becomes very painful and difficult. Lips, mouth, and tongue are corroded, which becomes white and hardened. Sometimes there are 20% of cases there is nausea and vomiting also present. In respiratory tract, if the person because of consumption, sometimes it may be inhaled, it may lead to pulmonary laryngeal edema developed due to irritation. Breathing is slow and labored, progressing to respiratory failure. When vomiting occurs, sometimes the poison may be aspirated to lungs, leading to bronchitis and bronchopneumonia, which is the late complications of poisoning. If some, because of vomiting, some amount is regurgitated and enters the lungs, it can cause bronchitis and bronchopneumonia, and person may die because of bronchitis and bronchopneumonia. Coming to systemic effects of carbolic acid, when it is absorbed, it is again, as I mentioned, it is breakdown to hydroquinone and catechol, paracatechol. It is phenol is usually the derivatives are depressant in nature, nervous system, depression of the nervous system, especially the respiratory centers. It causes headache, giddiness, unconsciousness, which is followed by coma. The temperature is subnormal, pupils will be contracted, there is breathing is treacherous, pulse is rapid, feeble and irregular, face is covered with cold sweat, and there is dusky cyanosis present. Respiratory alkalosis and metabolic acidosis are followed by that. Sometimes the hemolysis and methylcobalamin is present, which if present is characteristics of poisoning by carbolic acid. Coming to symptoms related to kidneys, the urine is the main, as I mentioned, urine is the main part where it is excreted. Urine is becomes scanty and contains albumin and free hemoglobin. So since it affects the kidney, the urine starts getting scanty and it mainly consists of albumin and free hemoglobin. Hydroquinone and paracatechol are excreted in the urine. So once it is excreted, they are grayish green in color, excreted, and they turn to black on exposure to air. because of oxidation. So hydroquinone and paclitaxel are usually in green in color. They are excreted as unchanged, some unchanged phenol as well as paclitaxel and paclitaxel are excreted in the urine. They are green at first because of hydroquinone and paclitaxel and turns black on exposure to air due to oxidation of hydroquinone and paclitaxel. This is known as carbuluria, that is turning of change in the color of the urine into black is considered called as carbuluria because of presence of carbolic acid derivatives. Chronic poisoning, if there is chronic exposure because of person who is regularly exposed to cleaning using phenol, it is characterized by anorexia, that is a person unable to eat properly, weight loss, headache, vertigo, dark urine and pigmentation of skin sclera. Hydroquinone and paclitaxel may cause pigmentation in the cornea and various cartilages, which is called as ochronosis. Ochronosis is commonly associated with alkaptonuria, in which hemogenetistic acid gets deposited in cartilage, ligaments, and fibrous tissue. Cause of death in carbolic acid poisoning, mainly first is the syncope, next is the asphyxia, which is mainly because of this failure of respiration, that is depression of respiratory centers leading to respiratory failure. Then edema of glottis because of the local effect of the carbolic acid. Then complications like if the worm enters the lung, it causes bronchodynia and person died because of asphyxia. Coming to treatment of carbolic acid, if phenol falls on the body, the affected part clothing should be removed at once. Skin is washed with undiluted polyethylene glycol or soap water, olive oil, or methylated spirit, which act as a solvent. An emetic often fails due to since it causes anesthetic effect. The person is unable to, the gag reflex is eliminated, so person may not be able to even emit or vomit the contents. The stomach should be washed repeatedly, carefully, and plenty of lukewarm water containing activated charcoal, olive oil, castor oil, magnesium or sodium sulfate, or even soap water if nothing is available, or saturated lime, which will with which phenol combines and forms harmless products. So has lots of fluid, any form of fluid and oils can be given to mainly to dilute the phenol combined to harmless product. Next, you can give the demulcents to prevent absorption, decrease the absorption from the mucosa. Then saline containing 7 gram of sodium bicarbonate per liter is given IV to combat circulatory depression, to dilute carbolic acid and increase excretion by producing diuresis. So lots of fluids are given so that the carbolic acid is excreted in urine as early as possible. Then hemodialysis if there is renal failure occurs. Then methylene blue is given mainly if there is a severe methyluria is present. Coming to postmortem appearance, external features. So yeah, immediately once the body arrives, there is a strong odor of phenol, which is diagnostic that the person may have consumed the phenol. So next, there will be corrosive of the skin. Has any corrosive, it causes corrosion of skin, grayish or brown color. Tongue is usually white and swollen. The mucous membrane of lips, mouth, and throat is corrugated, swollen, whitened, and numerous small hemorrhages, mucous hemorrhages are seen. Then coming to internal changes, the mucosa of esophagus becomes tough, white or grey, corrugated and arranged in large lymph nodes. The stimulus mucosa folds are swollen and covered by opaque, coagulated grey or brown mucous membrane. Often there is partial suppression of necrotic mucosa from severe congestion followed by underlying tissue. So there is a central necrosis is present followed by the congestion of tissues, then followed by normal tissues. The suppression will be seen. The stomach may contain reddish fluid mixed with mucus and shreds of epithelium and small smells of phenol. Duodenum and upper part of small intestine may show similar but milder changes, hence since some part may be eliminated. The liver and spleen may show whitish or hardened patch. So if the stomach is in close contact with the liver and spleen, uh, then there is the carbolic acid can cause whitish or hardened patch when the stomach has been in contact with them due to translation of phenol. So since the phenol can translate from the stomach to other organs, it can cause whitish to hardened patch corrosion in the liver and spleen. Kidneys may show hemorrhagic nephritis because of its immediate effect since it is excreted in kidney. So the carbolic acid may cause an hemorrhagic nephritis in cases of delayed death. The brain is congested, may be edematous. The blood is dark and semi-fluid or only partially congested. Laryngia as well as pulmonary may also occur. Test that to confirm it, test that whether the person has consumed phenol. Few drops of 10% ferric chloride is added to 1 ml of urine, which turns to bluish color, which may which positively which indicates that the urine contains some form of carbolic acid. It is not confirmatory, but it will be guide for further treatment. Circumstances of poisoning, medical importance. It is used for suicidal purposes. So phenol, which is easily available, it is used for suicidal purposes. Accidental poisoning mainly occurs in children who think that it may be of some form of fruit juice and may drink it. It is rarely used for homicidal purpose because of odor and taste. It is sometimes injected into vagina and uterus to produce abortion. Its indiscriminate medical use sometimes also can cause poisoning, like chronic poisoning lead to marasmus. Coming to next poisoning, formic acid, not so much usually available. So it is a colorless liquid with pungent penetrating odor. It is used as electroplating, tanning, rubber industries, airplane glue industries, stain remover, textile and paper industry. It is commonly used. It acts as a corrosive again on GI mucosa. It causes hemolysis leading to acute renal failure. ATP synthesis is also diminished by formic acid. It is about 20 to 200 ml of formic acid is fatal. In GIT, it causes burning pain, salivation, vomiting, mucosal ulceration, corrosion, and hematopoiesis. It can cause respiratory distress, tachycardia, bradycardia, hypertension, hemolysis, drowsiness, coma, diet of pupils, as well as on the skin, it causes blisters, then metabolic constitution, followed by shock and death. Treatment, usually milk and any form of diluent is given to dilute the acid. Gastric lavage antibiotics are contraindicated since it is corrosive, it should not be given. Formic acid 1 gram per kg IV 4 hourly intervals for 6 days is given to remove the acid. Dialysis or extra transfusion is also helpful. Postmortem appearance, corrosion and blackening of the gastric mucosa and pulmonary edema is typically seen. Other than that, other features of any corrosive is commonly seen. Medical importance, again, it is a form of suicidal or accidental, not used for homicidal because any corrosion is not for use as a homicidal because that it can corrode and it's very difficult to do. It's not done. Coming to boric acid, it is used as an antiseptic and insecticide. So commonly it is used as an insecticide for in grains. They mix in the grains to prevent insects, to kill the insects. 50 to 20 gram is fatal. Generalized symptoms include erythema, which resembles like a boiled lobster appearance. So on the contact with the skin, it causes erythema, which looks like a boiled lobster, with massive areas of discoloration indistinguishable from toxic epidermal necrolysis similar to that of Staphylococcus scale syndrome. These are my references. Thank you.